Hi, I'm Anne, a PGY1 pharmacy resident at North Memorial Hospital, and today we'll be talking about inpatient glycemic control for steroid-induced hyperglycemia through a pharmacist-driven protocol. Management of hyperglycemia in the hospital for patients with diabetes can be difficult and cause many complications, especially with the use of high-dose steroids. At our institution, we've been seeing a much higher use of steroids, along with a lot of higher incidences of steroid-induced hyperglycemia. With an increased risk of complications from uncontrolled hypoglycemia, including death, infection, and longer ICU stays, there's a greater importance of being able to manage hypoglycemia in those patients. At our protocol, we have a pharmacy consult service approved by P&T committee for use of managing hypoglycemia in most patients, including those on steroids and post-op open heart surgery. The glucose management protocol was primarily focused on post-op open heart surgery, but had a small subsection of steroid-induced hypoglycemia. With this study, we updated the steroid-induced hypoglycemia portion to include better recommendations in our protocol and are evaluating its effectiveness post-implementation. We compared the protocol with current standards of practice. Our standards of care involves physician-guided dosing and the use of sliding scale insulin, such as Novolog, or long-acting insulin, such as Lantus or NPH, when persistent hyperglycemia. To evaluate the protocol, we assess blood glucose levels starting 24 hours after identification of steroid-induced hypoglycemia or 24 hours after the start of the consult, and continue to monitor it while the patient was on the steroid in the hospital. The primary outcome is percentage of time the patient's blood glucose levels stay within 100 to 200 milligrams per deciliter on the steroid. Other outcomes are incidences of hypoglycemia and hypoglycemia to look at effectiveness and safety of the glucose management. So far, we have 46 patient charts reviewed, 16 on the pharmacist protocol, and 30 on standard of care. Average percentage of blood glucose is within 100 to 200 milligrams per deciliter, with 46% in pharmacist protocol group and 41% in standard of care. There were 2 incidences of hypoglycemia in the pharmacist protocol group and 4 incidences of standard of care. Overall, incidences of hypoglycemia were about 123 or 47% in the protocol group and 300 or 55% in the standard of care group. On day 4 of the steroid, incidences of hypoglycemia were 10 in the pharmacist, or 43% in the pharmacist group, or 40 or 48% in the standard of care. With the results of the study, we will look for any improvements that we can be made within our standards of practice and pharmacist guided dosing for insulin and the use of insulin and dosing. We hope to improve our practice with our glucose management so that we can provide better care to our patients. Thank you for listening and have a good day.